Okay, so here in this video we'll be discussing about the spastic cerebral palsy, which is nothing but an upper motor neuron lesion. So we'll be discussing that what is cerebral palsy, and we'll be discussing that what is spasticity. What we are noticing here in this patient is that facial muscles are normal. He doesn't has any paralysis in the facial muscles, but in the upper limb, what we see here is that in the upper limb there is contracture of the muscles. The tone of the muscles are increased. There is hypertonia which we can see in this patient, and we also see that there is decrease in the bulk of the muscle. So there is atrophy. Coming to the lower limb part here, the lower limb also there is hypertonia, there is increased resistance. The muscle tone is high, and we also see the bulk of the muscle is reduced. So there is atrophy here. We also see that there is contracture of the muscles in the lower limb. So now we are coming to the diagnosis that this patient is having spasticity, because spasticity only involves one group of muscle. Either it is involving agonist or the antagonist muscles, or we can say that it involves the flexor group of muscles or the extensor group of muscles. So in the upper limb this is usually involving the flexor group of muscle, and in the lower limb also we can see that the flexor group of muscles are involved. We also notice one thing, that his back muscle tone are increased. The posture of his muscle, he is having a stoop posture. Okay, now we'll make a diagnosis that why this spasticity has occurred. So what is the reason of this spasticity? So this is actually, there is a lesion in the cerebral. So we can say that this is spastic cerebral palsy. This is a type of cerebral palsy which is characterized by spasticity or high muscle tone, which is also called as hypertonia, often resulting in stiff or jerky movements. So we can clearly see that there is high muscle tone, hypertonia. Now, what is this spasticity? This arises as a result of injury to the bundles of the brain and spinal cord called the corticospinal tracts and the corticobulbar tracts. Whenever these tracts are injured, what they do, they actually supply the flexor and extensor group of muscle. So one of the tract will be hyper activated, and this will lead to flexion of the upper limbs. That we can clearly see in this video. So always remember that this spasticity is more often found in the flexor muscles of the upper limb. We can see that his elbow joints, the elbow flexors, these are flexed. And coming to the upper motor neuron lesion, yes, this is upper motor neuron lesion. We can see that there is paralyzed limbs, there is spasticity. Apart from spasticity, we also notice that there is exaggerated reflexes. So if we are performing any kind of biceps jerk or triceps jerk, the reflexes will be exaggerated, and we also see atrophy here. This spastic paralysis is caused by malformation of or damage to the parts of the brain that control the movements. Now this spastic quadriplegia is all the four limbs are more or less equally affected. So we can see here that all the four limbs are equally, and the patient is not able to stand. And if there is damage shortly after the birth, a stroke or a head injury or an infection, this causes spastic quadriplegia. So what are the risk factors here? The risk factors are the preterm birth or low birth weight, multiple births, incompatible blood type between mother and fetus, exposure to the toxins, or complicated labor. So these are the risk factors which can lead to spastic cerebral palsy. Now coming to the treatment part here, the treatment involves two things. The first thing which we'll be discussing is about the physiotherapy. So we give physical therapy, we give occupational therapy, speech therapy, conductive education, external braces, orthopedic surgeries. So these things are required as per the severity of the symptoms. Now coming to the medication part, yes, we give diazepam, baclofen. Botulinum toxin is of great help. Botulinum toxin reduces the spasticity, and apart from this we also give muscle relaxants like tinazidine. So this was all about spastic cerebral palsy, and we are very much thankful to our first year MBBS student Prakha Nigam, who has presented this video to us. And we are also thankful to the patient's family that they have given the consent. So this was all about spastic cerebral palsy. Share it with your friends. Okay, thanks for watching, guys.